Good evening, everyone.
Good evening, ma'am.
Good evening, ma'am.
Please keep your videos on. I can only see a few people. Okay, so good evening, everyone. I welcome you all to the Child Psychology Practical Program. So my name is Ranjima Ravindran. I am currently pursuing my master's in psychology from Jain University, Bangalore. I'm also a mental health volunteer at Indian Counselling Services. So ICS is a successfully running organization since the past 5 years. There are majorly two departments in ICS. First one provides one-to-one counseling, and the second one provides training and all the internship programs. ICS is one of the largest network of counselors and psychologists, and also a member of the International Applied Psychology Association. Now, before we start with the course, I would like to give you a brief introduction. I'll share my screen now. Am I not audible? Am I audible?
Yes,
Yes,
I can hear you.
You're okay. Okay, if I'm not audible, then please check your network connection. Okay. Can you all see my screen?
Yes, ma'am.
Okay. So once again, welcome to ICS. Now, yeah, first things first, I think all of you have installed the ICS app by now. So the Zoom links will be shared in the chat box in the app for all the classes. And also the study materials will be available in the library. And yeah, assignments will be uploaded in the assignment folder in the app. Now instructions, yeah, so from the library folder nothing can be downloaded or taken screenshots. Due to privacy reasons you cannot download anything. Of course you can take down notes when ma'am is taking class, and also we'll be sending you some, but you cannot download them. You can only access through them to the apps. Now for the recording, so recording of the class will be provided only in case of emergency. So if at all you're going to miss any classes, please inform us prior through an official mail. So once we approve the mail, you will be receiving the recordings. So again, please try to attend all the live classes. Then yeah, about assignments, it's very important. So need to, you have to submit it on time. So for all the assignment, you'll get 1 week's time each. So you have to submit it in 1 week's time in the assignment folder. Also the assignment, it will be accepted only in Word or PDF format. And these assignments are really important for your certificate or your letter of recommendation and your letter of appreciation. So please do take it seriously. Now the attendance, yeah, also very important. So all the participants must have 70% of attendance in order to get a certificate. So if at all you're missing any classes, please inform us prior through recent through the email. Now privacy and safety. So personal number sharing will not be allowed. And use the chat. There is a chat box option in the app. So use the chat box option only for your doubts or concerns regarding the course, not for any other personal information sharing and all that. So keep that in mind. Now, yeah, certificate or letter of recommendation. So this comes by the end of the course. So for certificate, to get the certificate, we'll share the procedure via the chat box, email, and WhatsApp by the time you finish your course. So you have to follow all the instructions given in the chat box. So once all that is done, you'll get the certificate. Now, yeah. So, thanks for joining ICS. This training gives you an opportunity through which you can look at the big and small aspects of your people around you, having any kind of mental or emotional support at the level of intelligence and prudence through the various methods of practical learning. We hope you get the most out of this training. So if you have social media accounts, do follow us on LinkedIn, Facebook, and Instagram. We Here you can, in the slide you can see we have provided an email ID and contact number. So in case if you have any concerns, this is how you'll be contacting us. So I request you all to take it down or at least take a picture of this. Okay. So yeah, that's it from my side. So Ms. Sonali Grover is the course facilitator. She's a RCI licensed clinical psychologist. Over to you, ma'am.
Thank you so much. Hi, everyone.
Hello, good evening, ma'am.
Hi, good evening. Requesting everyone to please put on your videos. It's mandatory to put on your videos for this session. How are you all doing? Good,
We're doing great,
okay,
ma'am.
average,
Doing good, ma'am.
Very fine, ma'am.
very
Doing just
fine.
fine, ma'am.
Okay, that's good to know. So, are you all excited for something different?
Yes.
Yeah. Okay, so
Yes, ma'am.
before starting, I would love to know all of you, and I'll give my introduction first, and then we all can know each other by our introductions, and then probably we can start after that. All right. So, hi, I'm Sonali. I am RCI certified psychologist, and I have a wide experience working with children, adolescents, as well as young adults, and I've been working for a couple of years in different organizations and doing a bit of my own private practice as well. So I'm also a certified happiness coach. So yeah, that's all about me. And I love talking to different people, knowing more, training them more, and so and learning from them. So that's something that I'm looking forward to from all of you. Yeah, that's why we are here to learn from each other. So let's make the most out of it. So, yes, so we can start with someone who wants to start up. So, firstly, you have to tell something about yourself. Then you have to tell what brings you here and what is one thing that you like about the most in yourself. Okay, chalo. Who wants to start? I think Suresh sir has unmuted himself.
Yeah.
So would you want to start? Okay.
Myself, Suresh Kantekar from Kolhapur, Maharashtra.
Mhm.
For last 5 years, I have been working as a counselor for adolescent students and for senior citizens. I teach mindfulness therapies and counseling also.
Okay, that's very good to know. So we
Yeah.
would love to learn more things from you. Definitely.
Yeah. Thank you, ma'am.
And what are you looking forward in this course? What are your things like?
I
What
would like
brings
to
you
learn.
here?
I would like to get good ideas about counseling for children, for which
Hmm.
that idea and that knowledge can be used for the society and for the children also. Yeah. Thank you, ma'am.
Okay. Okay. Thank you so much. Yes. Next. Anyone can speak up. Whoever, just unmute and speak up. There's no hard and fast rule that we are following one particular pattern.
Hi,
Hello, ma'am.
can you hear me?
Yes, Abhilasha, I can hear you.
Yeah. So my name is Abhilasha Thakur. I am from Nagpur, Maharashtra, and I'm field clinical psychologist, and currently I'm working at Tata Trust, which is working with community mental health. And so my interest for this course is because I'm working with different population in rural background, and I think for children it's very important where you can't provide them with medications. At least therapy can work best for them at their level. And so that's why I'm interested in course, knowing different kind of therapies and what can I apply to rural level as well.
Okay, okay. Thank you. Yes, next.
Hello, ma'am. Am I audible?
Yes.
First of all, sorry, I cannot turn on my camera because my network is not proper.
Okay. So try
Okay.
and
So
fix
my
it in the next class for sure. Okay, or maybe towards the end. Probably you could.
okay.
Okay.
Yeah, I'll work on.
Okay. Yeah, you
Okay.
were speaking.
Yeah, my name is Himani Bisht, and I am currently pursuing my master's in psychology. So I thought to start getting experience by this internship, practical experience. And I'm also taking private tuitions at my place only. And I'm seeing that students are like very, they are very fundamentally weak with the subjects. So I want to work upon those things with on working on their psychology, so that I can work upon them and I can teach them how to conquer those things fundamentally and how to clear the concepts, working on the mind maps and making plans for them, so that it will be beneficial for them and easy for them. And in future also I want to work as a school counselor as of now, so that's why I get into this internship.
Okay, okay. Thank you so much for sharing. Yes, next.
Thank
Anyone can unmute and speak up.
Hi, good evening, everyone. Am I audible?
Yes.
Hi, my name is Hiya Sharma and I am from Kota, Rajasthan. I just gave my exams for my bachelor's in psychology and I'm just exploring the subject and learning more about it so that I am sure that in what field I want to pursue my master's. So I'm just taking a break and learning more about the subject in depth.
Okay,
So
okay,
that's what brought me here.
okay. Thank you for sharing. Yes. Next. Kalyani, Vijaya ma'am, Arul,
Hi,
if
ma'am.
I'm
This is
pronouncing
Vijaya.
correctly. Yes, hi.
Yeah, ma'am. Actually, I'm a special educator for autistic and ADHD kids. So I want to know more about them. So that's why I'm joining this group.
Okay, okay. And where are you from?
I'm from Hyderabad, ma'am.
Okay. Okay.
Yes. Am I audible, ma'am? Hello.
Yes, yes, Kalyani, you're audible.
Yeah. Good evening, everyone. My name is Kalyani, and I am from Pune, Maharashtra. And I'm working as a school counselor in Pune. And I have joined because I would like to take more of a practical experience with the child, and I can handle the cases in the school. So because of that, I have joined this. Thank
Okay.
you.
Thank you. Yes, so who's left? I think just uh, Arul Sel. I think you are only left. Are you able to speak up?
Yes, ma'am.
Yeah.
Yes, ma'am. Ma'am, myself, Arun Selvi. Like I'm from Chennai. Like I have experience of 10 years of experience as a human resource professional. And just gave my exams for MA psychology. I wanted to in-depth knowledge, subject knowledge for child psychology. So it can change my career.
Okay. Okay. That will be great. So
Thank you.
knowing all your background, so I think most of you are from this background only. Yeah. So I think you have a bit of base in psychology and you know what it looks like and how, we can help children, and mostly you are all connected with children. Yeah. and that's why you've taken up this course. That really amazes me that so many of you would want to, learn more about how you can deal with in your jobs, maybe while you're studying, and uh, that's really motivating. So here in this course, we're going to be doing a lot of things wherein some things will be basic just to know, a bit. We'll be starting with the introduction about developmental psychology and all of that, just to see, how much you all know. And then maybe as the classes proceed, we'll be going into more of a practical base. We'll be doing different case studies. So all of you be prepared for different kind of role plays also we'll be doing. So I'll be giving you different cases wherein we'll be making plans, and we'll get to know how, how we can help our children wherever we are working, whatever we are going to do, maybe for those who are the college students. So you will have an idea in this course. So this is how the, structure looks like. I hope you've all seen the schedule. How does it look like? Yeah. So we'll be covering all that. So before we begin I have a few rules that we have to make. So videos should be on like at all times. There is no option of no in that. Okay. And second, if you're all on the same page, I would love to have a thumbs up from you all. Okay. So that I know, even if you're not unmuting and speaking, and a thumbs up so that I know at least you're listening and we're all on the same page. All right. And I would love to have an interactive session, like not just this one, all sessions, and would love to learn from all of you, and I'm sure you will also learn from whatever we do together. So since you all have a lot of experience in working, maybe studying or anything like that, so please do share in your experience, share in your inputs while we are discussing the topic. The more you share, the more you learn. So that's what I've believed. So if I give 1% of mine, I learn 10%. So that should be your whole idea. If you are giving your knowledge, and then you're definitely learning from the other person also. Okay. So do give in your examples, do give in your inputs. So that will be a great learning experience for all of us. And that's why we do these kinds of courses wherein we bring in professionals together so that we all can learn from each other, and we know how we should be on the same page, right? Being in this profession. So I'll just begin with. So today we'll be covering, like we did the introduction part, we'll be talking a bit about developmental psychology. Then we'll be talking about some general patterns of development, maybe some introduction to child psychology, a bit on that, and a few more things covering under this. So before I go in, what do you understand by the word development? A basic word. What does development mean to you?
Growth,
Growth, okay. And
Improvement.
improvement, okay.
progress,
Progress, okay.
Maybe a growth over a
Changes.
span of time.
Growth over a span of time, okay. So everyone gave a different kind of definition, which, ultimately meant the same, right? So that's how it has different perceptions. Developmental psychology, as the word suggests, it is the branch of psychology that focuses on how people grow and change over the course of a lifetime. Those who specialize in this field are not just concerned with the physical changes that occur as people grow, they also look at the social aspect, the emotional, and the cognitive development that occurs throughout the lifespan of an individual. So this is how it looks like. Developmental, yes. So the study of changes that occurs as an individual matures. So this is how, it starts from a baby till the old age. So a few principles of human development. Can somebody tell me anything different that they know apart from this that's displayed on the screen before I explain these? Have you all heard about the different principles of human development? I'm sure all of you must have studied a bit about that. Yeah? Anyone?
Ma'am, can I add one factor? Like development also depend on the culture factors as well, like how the raising of the kid varies from culture to culture.
Absolutely, absolutely. You're right. That I had in mind. Anything else? Because I feel that, some points are missing. So maybe if we can, add in something, that will be great. So development is till the time you can think over, I'll go over this. Okay? Development is relatively orderly. What does orderly mean?
Step by step.
Step by step. Yes. So it's going in a sequence that follows a particular sequence. So a sequence of steps that consistently follows one after the other. So that it means that development is happening. As you've seen in the pictures before, that it's happening in an orderly and sequential manner. Development is gradual and a continuous process. What does this mean? Can it happen overnight? Huh? Suresh sir, I think you're speaking. You're muted.
It's not a overnight process. It's a long-term process.
It's a long-term process. And do you think it's a very, speedified process, or it takes time?
Takes time.
It takes time. Absolutely. So development is very gradual. However, it's a very continuous process. It does not stops at one point of time or the other. It's a very continuous process that happens, but is very gradual in nature. Okay. Development is interrelated to each other. Most development is not solely physical, cognitive, or social or emotional. It's not just that we are physically developing. It's also the cognitive parts are also developing, the social emotional aspect is also developing. So everything is going on side by side and it is interrelated to each other. Development varies among individuals. Each individual's progress is unique. What does the last line mean? Can someone share an example?
Because
Ma'am, it means that every
yeah,
Anyone can speak up.
because
and
everyone has unique surroundings.
Hmm.
So according to that, the development varies.
Hmm.
And it is unique for everyone because everyone has a different kind of a surrounding and a different kind of a psychological movement.
Hmm. Okay. And anything else? That the last line, with the last line, I mean. Think from a child perspective. How can their progress be unique? How can it be
Ma'am,
unique?
it depends also on the family environment, the parenting style.
Yes, absolutely. The parenting style, the family environment, and anything else?
It
also the
depends upon the
economical and the social
socio-economical
construct.
conditions.
Socio-economical factors do play a role.
Yeah.
And what else?
Their physical parameters.
Yes, yes, their physical parameters. How about they're having some sort of developmental delay? Then their progress will be different from the child who is having normal milestones. Yeah. How about
Yeah.
having a speech delay, or how about having a physical delay wherein he's not able to sit, stand, walk at a normal milestone age, and he's walking a little bit later. However, he's walking, but he's walking a little bit later. So his progress will be a bit different from the child who is having a normal development. So it's not like his development is not happening only. It's not stopping, but it has its own progress. So that's why we as child psychologists, we as developmental psychologists have to be very, very careful about this aspect and have to be mindful whenever you are developing any kind of plans, whenever you are giving any kind of goals. So you have to keep that in mind. What is the child's progress? How much a child can achieve? So that's why we make individualized education plans, especially for children with special needs. Why do we do that? Because their progress is unique. It's not something that they can do at par with the other person. A lot of times there are group classes wherein you make common goals also. Yeah, there are group classes that are done, but not every child is, qualifying for a group class. There are a lot of children who are not able to attend the group class because they are not able to cope up with that kind of a thing. So their progress is unique. It's not like they cannot progress, but it differs. Okay, the degree of progress differs, and we as psychologists have to identify what is the child's strength and how much he can achieve in that particular point of time. So that's what is important, and that's why we are doing this base work, so that we get to understand all this at a later stage as well. All right. So coming to a bit of, what do developmental psychologists or psychologists have to, do. Okay, so the basic roles that are there, this is especially for those who are interested in this field. Cognitive development during childhood and throughout life. So you have to, these kinds of cases might come into you. Developmental challenges, maybe some sort of developmental milestones delay. Learning disability is also a very common aspect that you have to deal in with. A lot of emotional developmental concerns, a lot of language acquisition concerns, wherein you'll have to, in terms of that, you'll have to redirect the parents to the appropriate speech therapist or maybe some language therapist. So you have to do that. And moral reasoning, motor skill development. Yeah, so a lot of times you will have to, if you feel that the child is has a lot of delays in motor skill development, then you have to, and he requires occupational therapy. I hope you're all aware about what is occupational therapy. Yeah, can someone brief so that everyone is on the same page? What is occupational therapy? Anyone?
Occupational therapy usually works for the physical development of a child, like for a specific movement of a body, like if a child is not able to walk or due to some muscle stiffness or different limitations in growth of the body
Yes.
during childhood.
So there, the occupational therapist takes up these kinds of goals and help the child cover up that kind of, delays that the child has, especially during his physical thing. Okay. Is it clear for all those who were not aware? And for all those who were aware, this is the very basic terminology that we all should be aware about. Speech and language therapist, occupational therapist. So a multidisciplinary team works together. A psychologist, a child psychologist, a clinical psychologist, a psychiatrist, a speech and language therapist, an occupational therapist. So this is a multidisciplinary team that works together for the betterment of the child. All right?
Yeah.
So,
Okay, got it.
okay, sir. Coming to personality development, this could be also one area which you might be working in if you're into this field. Self-awareness, self-concept. A lot of times, this kind of an adolescent age group is somewhere you get most clients for self-awareness and self-concept. That is the appropriate age for that. Social and cultural influences on social child development. So that's another area wherein you might get clients on. So the role of developmental psychologist is to better understand how and why people change and grow. Developmental psychologists help people live up to their full potential. Understanding the course of normal human development and recognizing their true potential early on can prevent difficulties with depression, low self-esteem, frustration, and low achievement in school. So low achievement in school, what do you mean by that? What does low achievement in school looks like? For all the school counselors, can you help us understand?
Poor academics.
Poor academics. So why do they have poor academics? Do you think they do not study?
No,
They
it is
are
not
not able
able.
to cope up to the daily demands of the studies.
Yes, they are not able to cope up with the daily demands, but why is it so?
May have different perceptions.
They have different perception. Okay. Anyone else? A different answer, maybe? I want everyone to answer. It's okay, even if it's wrong, it doesn't matter. Everyone has their own
I believe that
perception of
low
that.
achieve. Can I continue?
Yes, sure. Please do.
Hello. Yeah, so I believe low achievement does not just stays till the point of academics, but it also goes to if an individual is actually able.
I think we lost her. Yeah, are you back?
Yes, I'm so sorry. There is some network issue here.
Okay, no worries. You can just speak up. We can hear you now.
Yes, so I was saying that, okay. So I believe that low achievement is not just related to the academics, but it also continues to if the individual is able to talk to his or her peers or not, or how they are in the co-curricular activities. And the reason for the same can also be developmental delay, and other than that, maybe because of some family pressure, or because of poor family conditions, they are not able to cope up in school.
Okay, so you mean socio-economical conditions, that could be one reason that they are not able to achieve. And another reason could be that they have some kind of delays. Maybe that means they are struggling with something. Yeah.
Yeah.
So, and they need help,
So sorry,
special.
ma'am, but hello,
Yeah,
am
you
I
are
audible?
audible. Yes, you are.
I'm so sorry. I actually got disconnected again. Can you please continue what you were
Yeah,
saying?
sure. I'm all ready. Hi, I can see Pushpalata ma'am. Are you there? Please put on your video if you're there. Requesting everyone to put on their videos. Yeah. So, yes, so mainly why they have a low achievement in school, that could be socioeconomic reasons, could be one, maybe they are having some kind of difficulties that they are not able to cope up in school, maybe some kind of delays that they have, because of which they are not able to, a lot of times they have, they're not able to concentrate, yeah. ADHD is something that's very, very commonly seen, because of which their performance drops in school. Yeah? So that is also another reason that could be a possibility. So for that, or the psychologist, does an assessment and goes about in detail about why the child is not able to perform.
Yeah.
Okay. So these could be a bit of possibility: ASD, cerebral palsy, Down syndrome, vision impairments, learning disability, ADHD. Did I miss out on any? I just gave a few examples of the developmental disabilities that could be possible. Did I miss out on any? Anyone can add? That you commonly see. Yes, no, maybe.
Common is ADHD.
Common is ADHD, true. And even
Many
a lot.
students we see.
Yeah, absolutely. Nowadays, especially with regards to, COVID, ADHD rate, diagnosis of ADHD rate has also increased. With excessive screen time, children are finding it very hard to concentrate when they are back to school. So, for all the school counselors, are you getting complaints like this? Very common, that children do not want to sit
Yes,
and
ma'am.
that they just want to go out. They are getting very impulsive, they are getting very restless, and a lot of inattentive mistakes that they are doing. So that's a very common complaint that we usually hear these days. And during COVID, due to excessive screen time, that has increased, and even researchers have proven that this has happened. So coming to the developmental stages, have you all studied developmental stages before? I'm sure all of you would have during your studies. So you have a rough idea. So with the developmental stages, I'm not covering those theories and all of that because I think you're all aware about that. And probably we could cover all that in the form of discussion probably. Yeah. So that can be a good idea so that it can be a revision for all of us also. And we're all on the same page then. For those who do not know, they will learn. And for those who know, they can have a revision. Okay. So that will be, I'm not covering that, but I'll just wanted to divide it into, few stages and just to let you know how you as a psychologist can help and assist in those stages. What kind of topics we can cover. So that will be a practical aspect of it. Okay. All right. Just moving ahead. Just give me a minute. So first one is the prenatal stage. Psychologists may look at how primarily reflexes emerge before birth, how fetus responds to stimuli in the womb, and the sensations and the precipitations that fetus are capable of detecting prior to birth. Developmental psychologists here may also look at the potential problems such as Down syndrome, maternal drug use, and inherited disease that might have an impact on the course of future development. So this is where the developmental psychologist plays a role, especially in the prenatal stage. So these are the three, stages that are a part of prenatal stage. I think you all would have studied about them. Yeah, I'm not going into much detail. Yeah, just wanted to do a brief recap. So 0 to 2 weeks, this is how it looks like. 3 to 8 weeks, this is how it looks like. And 9 weeks birth, this is how it looks like. Coming to the early childhood stage, the period from infancy through early childhood is a time of remarkable growth and change. Developmental psychologists here look at the physical, cognitive, emotional growth that takes place during the critical period of development. So why is this period called as critical period of development? Why do you think? Anyone can speak up about it. I'm sure all of you know.
Maybe because at this age, usually children start to speak and they would like to explore different things and they capture as much as possible from their own capacity.
Yeah, absolutely. Anything else?
Because at this stage, a child's brain is like a clear sheet of paper. So now they will write on this paper from whatever they are getting from outside, from their circumstances, parents, and everything they are hearing and watching and feeling. So they are making perceptions out of those things for their future use.
Yes, absolutely. So this is the most crucial age wherein the child learns everything. Yeah. So a lot of, kind of development is happening, and at the same time, it's a new thing also for the child. Yeah. So it's also a new thing for the parents. How do you think that the parents would feel like, for all the mothers who are there, or maybe the to-be mothers, how do you think that the parents would be feeling at this point of time? And how can psychologists help in here?
Ma'am, I am not clear with the question. Uh,
How can
can you please?
psychologists help in there? And how can, in the early childhood, how do the parents feel? Like, until unless you know how do the parents feel, how can you help the parents at this point of time? You're of course helping the parents here, where the child is, in the early stage. So that's the age of maybe 2 to 7. How, like, for example, if we are considering that, so how would we help the child if until unless we understand how do the parents feel? Do you think it's easy for the parents where so much of development is happening, and the child is at this point of time, the child starts getting demanding, child is very irritable a lot of times, maybe.
Yeah.
So a lot of development is happening. So how do the parents feel? That's what I want to know from you all. Do you all understand how would the parents be going through at this point of time?
The parents will think that
Parents,
only their child is doing like this.
Okay, the parents may think that their child is only doing like this. Okay.
I think the
Maybe
parents
their
might
parental
feel
problem.
overwhelmed with this thing.
Yes, absolutely. The parents will be very much overwhelmed. Do you think they all panic at this point of time? I've got a lot of clients like this. They're all very, very panicked, and they wake up at this point of time. Even if the child's development is not happening before, they might be like, "Ki ab ho jayega, ab ho jayega, ab ho jayega." Every child is different, as we say. And so at this point of time it becomes an alarming stage. That's why it's considered to be a very critical stage, wherein the parents also wake up that, okay, no, this is not happening as per the developmental milestones that my child should have achieved at this point of time, but he's not able to. So this is where the psychologists play a very, very important role. The developmental pediatrician definitely guides the parents through the developmental stages, and parents do keep a track, but a lot of times they feel that abhi ho jayega, kabhi kabhi late ho jata hai, nahi hota hai. So this is where the child psychologist plays a very, very important. So you have to psychoeducate the client and like the parents, and you have to make them understand that yes, if you feel that early intervention is required, this is the right age for early intervention. That's what I was looking from all of you, that what should we do? How as psychologists, how as professionals, what should we do at this point of time? If the child requires early intervention, if you are seeing some delays, then definitely do recommend for an early intervention. Why do you think early intervention is helpful and it's important?
It is necessary to track the milestones in the development stage.
Yeah. So, but why is
Unless
early intervention important?
yeah, intervention
Yeah.
is important.
Because I think, ma'am, if they are missing with this milestone, okay, they can cover up as early as possible, and they can achieve that much that we want to achieve as per their age.
Yes, as per their age, definitely. So, if they are not able to achieve, what do we do in early intervention? Does anyone have any idea? Have you heard about the term early intervention?
Will diagnose what disabilities he or she have.
Okay. What else? What happens in early intervention? Who does early intervention? Are there early intervention therapists? Have you heard of the word early intervention?
Yes, ma'am.
Yeah, ma'am, we heard, but don't know the actually what happened in that early intervention.
Okay, no worries, no worries. That's why I just wanted to
Ma'am,
ask. Yes, yes. Kalyani, are you
I
speaking
guess
or he is speaking? Okay, yeah, we can hear you now.
Me. Okay, so I guess that in early interventions, you basically first psychoeducate the parents, and then you create such an environment for the child in which whatever speed they are growing,
Hmm.
they will be able to grow more, and maybe because they are comfortable more in the environment,
Yeah.
they will be able to cope up with the situation as sometimes the child is not the development delay is very severe and
Hmm.
sometimes it's very mild. When it is mild, we are able to cover the steps. Like if the early intervention is happening at the age of 2.
Okay, we lost her again. Yes, she's absolutely right. So early intervention is something that you start in, early, as the word suggests. So these are the services provided by psychologists,
Yeah.
maybe some special educators, maybe some occupational therapists. So wherein, so I hope you are all aware about the domains of development. Yeah, we've discussed right now before. What are the main? Physical,
Mental.
okay, physical and
Cognitive,
cognitive,
social,
social, emotional, and what are the other areas? Sensory. What is sensory?
sensory issues,
Sensory issues क्या होते हैं?
It is
drooling, chewing.
sensation.
Sensation. ठीक है, तो sensory and adaptive. ठीक है, so 5 areas of development होते हैं: physical, cognitive, communication, social और emotional, sensory and adaptive. ठीक है, सो ये 5 एरियाज हैं. 6 मैंने इसलिए करें क्योंकि इमोशनल, सोशल एंड इमोशनल दोनों एक साथ आते हैं. दैट कम्स अंडर वन कैटेगरी ओनली. ठीक है, सो दीज आर द 5 एरियाज. सो अगर इन 5 एरियाज में से किसी भी चीज में डिले है for any child, then we do recommend for an early intervention. If you see that there are mild delays, then if the child is provided early intervention at the right age. So early intervention happens from 0 to 3 years of age. ठीक है, so as soon as the child is born, थोड़ा time तो रुकते हैं एकदम से, तो you do not start intervention. Of course, you will see the milestones, but it is usually considered that age group up to 3 years. 3 to 4 भी 4 तक भी हो जाती है. ठीक है, mostly they do consider, but yes, and technically it's still 3 years. ठीक है, so that the child's milestones can be achieved and there is a lot of progress. Agar jaldi hi, why is early intervention important? Early identification helps in the child to cover that gap that is being
Yeah.
there. ठीक है, and help the child come at par with the other students. If early intervention is not done, then the delays are further. Then the child has faces concerns in school. If he's admitted, like if he gets admission in school, then he faces delays, and then there is a chance of getting diagnosed with a disability. So a lot of times a lot of children do cover up those gaps and they are able to cope up. I have seen a lot of kids that they have really shown improvement if they had early intervention at the right time. So this is why as psychologists you have to assess, will the child qualify for a early intervention service? So then definitely they can be provided with one.
Yeah.
And there are a lot of centers who do early intervention, so it's not like it's not there in India, and it is growing only. So this industry is also growing. However, it outside abroad, outside India, it's much better, progressed. But in India also, it has grown. From last few years, it has picked up, and there's a lot of therapists who are engaged into early intervention. So, middle childhood. This period of development is marked by both physical maturation and increased importance of social influences as children make their way through elementary school. Kids begin to make their mark on the world as they form friendships, gain competency through schoolwork, and continue to build their unique sense of self. Developmental psychologists to help kids deal with their potential problems that may arise at this age, including social, emotional, mental health issues. So, what do you think would middle childhood be like? What kind of concerns would the psychologist be encountering?
Concerned in the learning of a children
Yes. And learning.
and
Learning is one thing.
concern,
Difficulty to cope up with the another environment, like
Yes. Okay. Another environment. Another environment
like for example from home to school, like in early days, yeah, they must be having difficulty to cope up with that environment.
Okay, so that might just come under early childhood only. So these are in the middle childhood age. Huh? So they've already transitioned. So that's also a concern of early childhood wherein the transitioning issues and all of. So here their emotional, social development is happening. So a lot of self-esteem related issues are observed. I was looking forward to some. They have a lot of, fights
they
at
might
this point of time.
issues.
Friendships become important, don't you think?
Yes, they might have anger issues,
Anger issues
performance
और
issues.
परफॉर्मेंस इश्यूज भी आते हैं बट अभी इस स्टेज पे थोड़ा थोड़ा डेवलप हो रहे होते हैं सिंस दे आर गेटिंग टू नो दैट ओके their social emotional mental well-being is getting so a lot of times I have seen a lot of cases wherein at this point of time the children are they are getting very anxious. Have you all experienced this? I won't term it as anxiety, but they get very anxious on small little things. Maybe as simple as we have a test in the next day. Yeah. So few, small things that are making them anxious at this point of time because it is a transition again to add like to adolescent to that so this is the middle stage wherein the transitioning is taking place. So a lot of concerns like this, a lot of concerns of bullying also happens at this point of time when they are transitioning to adolescence. So that's also something I'm looking forward to some practical examples from you all. I can't
Changes in their
hear.
the changes in their body,
Yes, absolutely. The changes in their body is something that makes them feel conscious a lot.
hormonal changes, and
Hormonal changes, yes.
physical growth,
Couldn't hear you.
hormonal changes and issue regarding physical growth and everything regarding that.
Okay. How about others? Those who are muted, it's not allowed in the class. Please do unmute and put your videos on. Everyone has to speak up. Yes, Abhilash.
Yeah, so it may be body image issues as well.
Body image issues, yes, definitely.
And
One
Kalyani,
thing,
Vijaya.
like
Yeah, Khushi, speak up.
yeah, so there are lot of changes that are going through in the body which are basically hormonal, but parents and the children are not able to diagnose it in that way. So we see that we consider that these are more of behavioral issue, but I think those are more developmental issues. So we have to counsel according to that, and we have to calm them down first.
Yes, absolutely. So early childhood, like the middle childhood and the adolescence. So these both are the very, very important years wherein even parents struggle while dealing with the children. Even parents are also at a giving up stage that no, I can't just handle this child. So a lot of times children also do get overboard and parents do give up. So they will come to you very frustrated. Ma'am, I can't handle this child. I don't know what's wrong with this. What's wrong with him? And then when you listen to the common concerns and you'll be like, oh, that's every child is behaving like this. That's absolutely normal. That's not something different that you're experiencing. So this is something that you will get. So at the adolescent age, wherein the kids test limits, explore new identities, as they explore question of who they are, who they want to be. Identity formation happens at this point of time. So developmental psychologists can support teens as they deal with some of the challenging issues unique to the adolescent periods, including puberty, emotional turmoil, social pressure. What else could be some of the concerns here at
Ma'am,
adolescent
maybe they
age?
are not uh, maybe they are not able to do what they want to do under the pressure because their parents are overachievers.
Okay, their parents are overachievers, so you feel that they are not able to cope up. Okay.
Yeah. Even
Ma'am, might be the
sometimes,
comparison with sibling.
Comparison with sibling, absolutely right. Yes.
sometimes parents are also unable to cope up the situation.
Yeah.
They forget that some long back they were also in that stage.
Yeah. Yeah. And why is it considered to be the most difficult stage?
Lot of
Yeah.
cognitive, emotional, physical changes are there.
Yeah.
So
And what?
yeah,
As ma'am, we have here is a identity formation. Because of that, I think it is very important because this stage impact in overall your future, whatever decisions or whatever personality you are having, it is more important. And ma'am, for that, they are more of having a hormonal, and because of that, their behavioral changes are there, and they don't know how to handle it, okay, because sometimes it is out of control, and then they don't know, and sometimes they must be feel yeah, nobody is understanding me rather than my friends, okay. It is
Yeah.
like parents also doing the same thing, teachers also doing same thing, relatives are doing the same things, but nobody is understanding me.
Yeah.
So it is like that they
So
are
how do
having
you
so
think parents should react at this point of time? What would you as a psychologist suggest to the parents, especially at the adolescent years?
Yeah, ma'am. First, I think I should tell I should tell them have patience. Have patience to deal with your arousal. That is the most important thing.
Hmm. And
They should be more
I
friendly with them.
think we like the part which is immovable, like the hormonal changes and all, so that they have a basic idea that what is going through their children and how they
hmm.
can support that thing.
Yes, absolutely. And do you think parents should be the go-to people for the child at this point of time, wherein he is not able to understand what's happening with him or her? Yeah.
Absolutely. But
So
actually, it's not happening. So counselor should be a play middle role in between adolescents and parents.
So yes, so you as psychologists have to counsel the parents that yes, give them that sort of a comfort level so that they become, maybe mother or father. One parent should be the child's go-to person. So if anything happens, the child can come and tell it to the parent. Maybe. So if the parent will also have an authoritative parenting style at this point of time, do you think things might work?
No.
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 Yeah. So a lot of times parents do not understand the difference between this. So you as psychologist have to psychoeducate that yes, if you will be demanding and you will be authoritative and you will be ruling over the child will not listen. So you have to be friends with him. He has to have that confidence that yes, maybe mama is there for me, papa is there for me. Maybe one parent should be the child's go to person. So this you have to ensure. And if not, then a lot of times you can suggest at this point of time a lot of counseling can be done. Here at this point of time the child is ready to understand also the counseling. Before this age, child counseling might not be very very successful. Yeah, adolescent is a good age to start in counseling, maybe a bit before also, but yes, adolescent age is a good age to start counseling. Okay, so this is where you can, if the child is not able to understand, if the child is still having a lot of concerns, a lot of times school से complaint आती है like कि ये क्लास में टिक के नहीं बैठता है, इसको हमेशा बदमाशी करनी होती है. At this point of times, the children are trying to rule over everything as much as तमाशा जितना कर सकते हैं, जितनी सारी ट्रिक्स टीचर्स के साथ खेल सकते हैं, they do try and explore everything. Don't you think? Yeah. So, and then because of that, parents have to go to school and hear the music, and then they come home, and then they spank the child. They engage in hitting, or they engage in any kind of an thing that's aversive for the child. Yeah, and that creates a distance between the parent and the child again. And then there are a lot of concerns right after that. So if that's a very very frequent practice, either the child will engage into lying, that he will not even tell. A lot of kids do not even come home and tell that their parents are being called. अब तो चलो बहुत online की वजह से there is a lot of connection between teachers and parents, but earlier maybe a lot of times diary or just an email was a form of communication. So children used to avoid that. So now teachers have directly started approaching. Phone aa jata hai, email aa jati hai. So that has become better after the online. They can easily approach. But yes, children do engage in all sort of things. So you as psychologists have to ensure that there is one person, one go-to person, and also help them develop a peer support, because at this point of time peer support is something that's very very important. Right kind of peer support, right kind of peer support either can make the child or break the child. At this point of time they get very much influenced by each other. They start getting, oh वो तो ऐसे करता है, मैं भी ऐसे करूंगा. So वो चीज बहुत ज्यादा prominent हो जाती है स्टेज पे. ठीक है? So that is also.
Hello.
Yes sir, yes sir, please do.
opposite sex का attraction भी शुरू हो जाता है.
Absolutely, absolutely. जिसकी वजह से काफी concerns आते हैं, and which is why counseling is essential at this point of time. ठीक है? So you can target this point here, ठीक है? For counseling. If you want to pitch in for counseling, then you can at this age. So early adulthood, this period of life is often marked by forming, maintaining relationship. Critical milestones during early adulthood may include forming bonds, intimacy, close friendship, starting a family. Those who can build and sustain such relationships tend to experience connectedness and social support, while those who struggle with such relationships may be left feeling alienated and lonely. So developmental psychologists here can support in building a healthier relationship and combat the emotional disturbances that an individual goes through. So anything else that the developmental psychologist can do here, or the psychologist can do here, or the counselor can do here? And what do you think, what kind of cases might come in for those who are dealing with this age group? Yeah.
So during this stage, there's possible 2 or 3 scenarios can be present. First is a self-harm, and the second is a drug abuse. And it may be the beginning of phase of depression, where their defenses is through self-harm or abusing of drugs, and more but with peer pressure as well.
Yes, absolutely. Peer pressure, bullying, getting into any form of substance abuse. That's also something. Alcohol dependence, definitely at this point of age, wherein the children are very much influenced by, the children or adults are very much influenced by each other. yeah, or maybe the groups that they have, maybe the college they are going to, and what kind of uh, environment they are living in. So social economic environment also plays a very very important. What kind of background do they belong to? Yeah, that also plays a very very important role. What kind of family gatherings do they go to? That also has an impact. If they see other people engaging into these things, so they feel that it's normal, it's a normal behavior, and they also feel that okay, we are also allowed to do that. Yeah, so that's also something that you get to hear very commonly. Any other thing that you get to hear at this point of time?
Ma'am, and one more thing is like even parents like confuse them like, yes, you are old enough, but you're not old enough to do such things.
Yeah,
So they get
absolutely.
confused to set the
What is,
boundaries.
yeah, setting boundaries is a big task here, because then parents are also like, should this stop? Would they feel offended or not? Because they are young adults at this point of time. So they should intervene or not intervene. Don't you all relate to this? Yeah. Yes. Anything else? I'm sure there are many other things. We're not speaking out.
Ma'am, even early pregnancies, unwanted pregnancies, which happen during the
Yes.
college days.
Absolutely, absolutely. You're absolutely right. So those are also some of the concerns that come in. Definitely.
Little bit transition period.
Yes. Transition period. Yes, definitely.
They are neither adult or nor grown up.
Yeah.
Most of the parents treat them as children only or adult only. So lot of differences
Yeah.
are noticed in the family.
Yeah. And also some of them start working in. Yeah.
Yeah.
So that is also a lot of changes are happening. They tend to get frustrated because it's a new transition that happens, right? So they tend to get depressed. Anxiety is seen very very commonly at this point of time.
Yeah.
They tend to feel socially isolated also, because they are not able to manage the home and work, you know that kind of a thing. They're not able to balance a few responsibilities for those who get married at this age. So a few responsibilities also come in, and when you have to do a lot of things together, so then also you need counseling at this point of time. So this is also one area where you might have a scope in to work. Coming to the middle adulthood, so this stage of life tends to, yeah,
Ma'am,
yeah, yes,
I'm
yeah.
sorry to interrupt, but also when they, so one of the reasons can be when themselves identify themselves as the adult
I
and
can't hear you.
am I audible now?
Yeah, you are, but your voice is cracking.
Yeah.
But speak up. Yeah, yeah. Speak up. Your voice is cracking a bit. But speak up. We'll try to understand.
Okay, type in the chat box.
Okay, sure. So here in the middle adulthood, this stage of life tends to center on developing a sense of purpose and contributing to the society. What does this stage mean? How do one contributes to the society here at this point of time?
By their work.
By their work, yes. And with the additional responsibilities that they have at this point of time. Yeah, maybe they are trying to do, they are at their peak of their careers also at this point of time. Yeah,
They need to take care of their parents'
they need to,
responsibilities.
yes, they need to take care of their parents. Yes, absolutely. They have additional responsibilities of their own family as well as their parents.
they
meeting
have
social standards like buying a car, buying a house.
Yes, absolutely. So settling into the career, fixing it, and reaching to the top of to their best of their potential, achieving that, buying a house, buying a car, having basic amenities along with the luxuries also. Yeah, that one aims at this point of time. So what concerns could that bring in? We are looking at okay what they want to achieve. So while achieving that, how can psychologists play a role here? Can they help them in achieving that also? Do you think? Can
Ma'am, during
counseling?
this phase, like they might have a job security as well, job insecurity, whether uh, their finance will be supported further or not.
Yes,
Or like
absolutely.
maybe even if they are in relation with their spouse, will it how it will be, how will it get affect in any aspect in their life,
Yeah.
and how will be they will be able to raise their children as well. So like multiple
Yes.
factors being by playing different roles can affect their emotional balance.
Yes. Selvi ma'am, can you please speak up? Couldn't hear you at all. After the introduction, you didn't speak up. You're on mute probably. Can't hear you. Just try and fix your audio if you're speaking up. Can't hear you. Okay. So yes,
Ma'am, actually at this stage they have so much of mental pressure also due to the work, family
yes.
problems also there.
Yes, so while achieving all the luxuries as we discussed, so this process is not easy. Yeah, there are mental breakdowns at that point of time when they are not able to, achieve what they actually, everyone strives for a higher goal, right? If one has achieved one thing, if you've bought a car, then you achieve to buy a house. Okay, so then you strive again for that. So once you've achieved the second thing, you try to strive to achieve the third thing. Yeah.
Yeah.
So and if a person is a lower middle class family, then the person wants to become an upper middle class family. If a person is upper middle class family, they want to go into a higher strata, right? So everyone has different goals and they have individual progress in life. Yeah, that's why every individual is different. They have different goals in life, and how they achieve is different. So a lot of people do face concerns while they are achieving their goals. So this is also where psychologists can help and support them in their day-to-day emotions, how they feel, how a lot of times they have lower self-concept. They are capable of so much, but because of their lower self-esteem, they are not able to achieve those goals. So can you help them? Do you feel that psychologists can help them here? Yeah.
Yes, of
So
course.
this is one very very important aspect wherein the psychologist can help them achieve their goals by enhancing their self confidence, which is lowering down due to like for example during COVID, as the COVID came, it was very sudden shock for a lot of people. Yeah, so a lot of people who lost their jobs, a lot of people who had to face a lot of distress. Their businesses got shut down. They had to change and switch a lot of things. A lot of people changed their business. So that was a transforming stage for them. Do you think was it easy for them? How much distress they must be. Everyone likes to be in their comfort zone, no? Everyone has that goal that okay, they will achieve this much, and then suddenly something happens, and then you have to start it all over again. Yeah, so
Yeah.
at that point of time a lot of people required help. Yeah, so this is where psychologists, you as psychologist in the future, please can help and support, and please do try and reach out to as many people as you can. Yeah, especially in this condition, that will give you a practice also of counseling, and that will help you earn money as well. Okay, so it's a two-way process, and you will be able to do some good to the people. If you are trained in that, then do help in such situations. Did any one of you worked up in COVID? Maybe in some COVID helpline, volunteered, did something? Anyone?
I worked.
You worked, sir? Okay, that's great.
Yeah.
Anyone else supported being in this field? Maybe started your own practice. That could also be a possibility of supporting. Okay, just
I
one.
volunteered at an NGO.
Okay, that's great. Yeah, that's what I was looking for. Maybe if someone could do, then please do help in such cases. ठीक है? Chalo. Coming to older adults, the senior years are often viewed as a period where there's poor health. It's not always, but for some. Yet many older adults are capable of remaining active and busy like while they're into their 80s, 90s. Increased health concerns mark this period of development, and some individuals may experience mental declines related to dementia. Developmental psychologists may work here with elderly patients to help them cope up with the issues of aging. What do you think would be some common concerns at this point of time? And how could we support as psychologists?
I think first of all, the physical parameter is a basic concern for almost every like older people.
Hmm. True.
So we can work upon that by counseling their near ones, because the thing that every older person want is to be with someone who can take care of them.
Okay. Absolutely. And what else? Older adults. Just imagine. Maybe you could recall your grandparents and consider what kind of concerns they might be going through.
Ma'am, the first concern is regarding somatic complaints of a body pain or headache. And
Yeah.
the second is their insecurity that they will be left, like their son or daughter or anyone won't care of them, won't take care of them.
Yeah.
And the
Yeah.
third possibility is that of dying. They're very afraid of dying, that they might die because of a serious illness or something.
Okay. Yeah, that's true. So there's a lot of emotional disturbance that they are going through at this point of time. Maybe they feel lack of love, which they've not experienced before, and which is not even true. Children do help in their parents, and children are there for their parents. But yes, at this point of time, the parents do feel, or the grandparents do feel that this is something that my children might not take care of me, or my children are not giving enough time to me. That is also because their children are into that stage where they are running the mad race of earning, settling down, and everything, and they are not able to devote 100% time to their parents. So which is why they feel very much distressed, and some of them do suffer from dementia, which is why there are a lot of assisted living homes that are there, which help them, and there is a lot of social skill training that can be done with them. Even you can take group sessions if you want, like if you can take individual sessions with them. A lot of counseling helps them, trying to give them small happiness. Maybe trying to boost their morale. A lot of times maybe you teach them some skill, they might forget the next day, so you have to start all over again. So this is also something that's very common. I know we are into this child psychology course. You must be wondering that why is she discussing about older people, but yes, we are discussing about their development, so that's also important. So even if you are a child psychologist, you should be well equipped to deal with all sorts of clients.
Yeah.
That's all right. You do not take up other aspects. That's by your choice. But you should be equipped to deal with, because there might be times when a child's grandmother might come come in with their child, then what will you do? If you're not aware about how to deal with them, then how will you deal with it? Yeah. So you should, being a child psychologist, you have to be multi-talented, dealing with all sorts of age groups. Because a lot of times children's sisters come or brothers come. So you have to deal with that kind of age group. Then a lot of times parents do come in, so they are in their 30s, 40s, 50s. Yeah. And then a lot of times children do come in with their grandparents, so you have to deal with them until unless you are aware. If you're not sensitive towards the concerns, then you might start getting frustrated. Oh my god, आज तो इसके grandfather आए थे, मेरा तो दिमाग ही खा गए. ये सब बहुत बहुत लोगों का बहुत common पर्स है, वो मेरे को सुनने को मिलता है. A lot of young psychologists say that मेरा तो दिमाग ही खा गया, आज उसके grandfather आए थे. But no, we should be sensitive towards that.
Yeah.
That they are in that age group, that they are, maybe they are speaking more because they want somebody to listen to them. So being a psychologist, being a counselor, you have to be empathetic towards that. Yeah. So if you will not be aware about this part of development, then how will you deal? So you, being a child psychologist or a development psychologist, have to be very much multi-talented, dealing with all sorts of age groups. So you should be aware. ठीक है? इसीलिए हम पढ़ रहे हैं. So don't feel कि हम adults क्यों discuss कर रहे हैं यहाँ पर. ठीक है? Okay, anything else that you want to add up? और क्या होता है with older adults? Anything else? Maybe we've missed out on something.
Losing their
Sometimes existential crisis.
Losing their spouse, existential crisis. Absolutely, that's also something that maybe a lot of times losing their children. Yeah, due to some early deaths or so. How do they deal with that? Being at this point of time wherein they feel that their child has gone before them. What kind of an emotional distress they go through. Yeah. So that this is also where a counseling can be done, just to make them feel that it's okay. Some things are out of our control. Yeah. Some things are in our control and some things are out of our control. Yeah. So this is also another aspect that comes in when it comes to this age group. Anything else that you want to add up, or should we move ahead? If you feel that we missed out on anything, just brainstorm once, just give it a thought again.
I think
Yes, ma'am,
early perception.
Helplessness and dependency, ma'am. Dependency and helplessness.
Yes.
Must keep going.
Yes, a lot of times they get detected with a serious disease at this age, and which also makes them distressed. Maybe they are not able to go and cook.
Yeah.
Which earlier they used to be. So for a lot of women, that's the tool, and that gives them happiness. After a point of time, that starts giving them happiness, that, oh, I'm not able to cook what I want to cook for my family. So they are into that guilt. Yeah. So even in the middle adulthood, this is also one of the concern. If it's a working woman, she's not able to cook for her family, or she's not able to take care of her family. So that's also somewhere she's not able to do a work-life balance. So this is also another aspect where counseling is required. Yeah, so that she does not feel guilty, and her mental health should not get affected because of that. All right, so it's time for a quick quiz. Yes, do you want to add up?
Maybe yes, frustration due to the new advancements, not able to cope up with them, and sometimes the new ideologies.
Yeah, absolutely, the new ideologies. Yes, so this is for the older adults, or this applies for all?
It is middle and older adults.
I think it's
And
applied for all.
for young adults and adolescents.
Yeah, yes, it's applied for all. For not being able to cope up with anything new that's coming up. So children learn very fast. Yeah. And adults do take a bit more time than children. Yeah. and they are more smart because they are being exposed and they've been born and brought up like that. Yeah. So their peer group support is there. When you are into adulthood, you have a limited set of social group that you engage in. Maybe a few friends you engage in with them, maybe on the weekends. So kids are meeting their peers every day, so they are learning so much. So that's the only difference, that they are able to learn quick, and adults do take time. So they feel that, oh, let me learn from my child, and then the child also does nakra. So then parents do feel disappointed that we are not able to we are not able to learn from my child. Whom should I learn from? So especially when this COVID thing came up, especially I hope all of you know that everyone struggled with technology. Not everyone knew how to use Zoom. Yeah,
Yeah.
everyone learned. A lot of people learn them from their children. A lot of people do explore it like that. Yeah. So this is where I got to see a lot of clients wherein the parents were very much frustrated that I ask him for small things and he just denies. So I got a client for an adolescent age group. So his mother used to call him every other second and then ask him, ये कैसे करना है, ये कैसे करना है, and he said कि मैं हर समय थोड़ी ना अवेलेबल रहूंगा मम्मी, मैं पढ़ रहा हूँ, मैं अपनी क्लास में हूँ, मैं आके थोड़ी ना हर समय आपको सिखाते रहूंगा. So this was a concern that I got for counseling. So this looks such a small and a petty thing, but that really affected the mother's mental health. Huh? And the relationship that they had, that got affected a lot. So I know we are laughing at this moment, listening to all this, but it was a very serious concern. I did not get just one client. I got a lot of cases like this at that point of time. So that was a big concern, and I never imagined that this could also be one of the primary concern that we might get at that point of time, despite everybody struggling. So let's start with a quiz.
Ma'am,
Brief. Yes, I've just stopped sharing. Yes. Yeah, I think you.
ma'am, also the fear,
Hmm.
yes, also the fear of coming out of closet is one of the main concerns which has been seen for adolescents and adults also, and for parents also, to accept the fact that their kid this is not from one particular gender. Maybe they identify themselves as something else.
Yes. Yes. Absolutely. Absolutely. Anything else before we start in the quiz? Do you have some inputs? No. So let's see. Let's test our knowledge.
Okay.
So some questions might be, things that are a revision for you. And even if you don't know, that's all right. So by the medium of quiz, my whole intention is so that we learn. Okay? So can anyone volunteer to read up the question? Just unmute and help me in reading the question. Anyone can do that.
I will volunteer for that.
Okay. I hope you're able to
Okay.
hear you.
Hopefully, because my network is very bad.
Okay, maybe somebody else can read up the.
No.
Kalyani, can you
Yes.
do that for us? Kalyani, am I audible? Can you do that for us?
Yes, ma'am. Yes. Yeah. Okay. Dr. Mosquitoes, right? I don't know the pronunciation.
Matsukos. Yeah.
Mosquitoes' major research interest is the long-term effects of child rearing
Rearing practices.
of the psychological adjustment of offspring. It is most likely that Dr. Mastiko is a that psychologist.
So is he her cognitive psychologist, developmental psychologist, behavioral psychologist, psychodynamic psychologist, or an educational psychologist?
Cognitive.
Mostly it may be developmental.
Developmental.
Okay, others? I want everyone to answer. I'm marking you on this. Quickly. Developmental, okay.
Developmental only.
How about others? Pushpalata ma'am, please unmute and speak up now. I don't allow anyone to, not talk. You have to talk in my session. You can't just be there. Yes. Others? Everyone agrees that it's developmental or it's cognitive? Think
I think
again.
Developmental.
Sure?
Yes.
Yes, you're right. It's developmental psychologist. Good job, everyone.
Thank you,
Next
ma'am.
one. Who will read? Abhilasha, can you read this
Yeah.
one?
Yes, sure, ma'am. Statement is the correct order of the three stages of human prenatal development are: the first option is differentiation, implantation, strengthening. The next one is embryo, zygote, fetus. The third one is placental, umbilical, and embryonic. The fourth one is embryonic, placental, umbilical, and the fifth one is zygote, embryo, fetus.
Yes.
I think I will go with the B option, like embryo, zygote, and fetus.
It's B, ma'am.
Sure?
Yes, ma'am. B.
Yes, ma'am. B.
B.
Checked? Checked on the internet also? सब बताओ जल्दी से. I want answer from everyone.
B.
Between A and B.
Are you sure? I think it might be
Confused.
something else.
E or B, ma'am.
A or B?
Yeah, confused between
Sure.
Embryo and zygote.
Sure हो जाओ पहले. सबने पढ़ा है ना ये?
Yeah.
yes. Order याद नहीं आ रहा.
याद नहीं आ रहा. It's the last one. It's E. I was just waiting कि सब एक बार देख ले, maybe ध्यान से देख ले, but सब stuck थे क्योंकि एक ने बोल दिया ए तो फिर सबको लगा कि चलो ए आंसर. चलो, this is how we all learned. ठीक है? अब नहीं भूलोगे ना?
अभी नहीं बोलूंगी.
ठीक है? चलो, next. The intense, enduring social emotional relationship that develops between a child and a caregiver is termed imprinting, intimacy, attachment, menard, temperament.
I think it's C, attachment.
Okay.
Yeah.
Everyone, unmute and speak up.
It's C, attachment.
Attachment only.
Okay. Vijaya ma'am, Arul ma'am, speak up. Khushi, speak up.
attachment.
Okay. Hiya, speak up.
It's C, attachment.
Yes, you're all absolutely right. It's
Yes.
attachment. Next one. Okay, another theory. The correct sequence of Piaget's theory of cognitive development. First one, pre-operational, sensory motor, concrete operational, formal operational. Pre-operational, concrete operational, sensory motor, formal operational. Sensory motor, pre-operational, concrete operational, formal operational. Sensory motor, pre-operational, conventional, post-conventional. What do you think?
I think B,
Eh,
option
B, okay.
I think C.
B,
Even
C,
I think C.
okay. B, C, ठीक है.
B. I think B.
Okay. सबको काफी सोचना पड़ रहा है मुझे लग रहा है. भूल गए हो सब? See, it was a bit of theory, तो मैंने सोचा कि we'll cover it like this. ठीक है? So that it's not boring for all of us. Because I know कि सबने पढ़ा हुआ है. What's the point to repeat? Yes, Kalyani, what do you think? B, C, A?
Ma'am, I think it's A.
It's A. Khushi, Hiya?
I think it's C.
You think it's C? चलो देखते हैं कौन सही है. देखते हैं. Let's check what's the correct answer.
I told B earlier.
It's C, sensory motor.
Oh.
Those two options were very close. Sensory motor, pre-operational, concrete operational and formal operational. ठीक है, अब सब याद कर लो. For those who said any different option, this is the correct sequence order. ठीक है, आना चाहिए. ये तो बहुत बहुत famous theory है. ठीक है, if you're into this field, you should know. ठीक है, और कल कौन इनकी explanations ready करके लाएगा, so we can have a discussion on that. Who's going to do a research work? Actually, everyone has to do, but who's going to present? Maybe that I can decide tomorrow. So this is the homework for today. Okay, you can write it down. For all these 4 stages, what are they all about? Okay, one line brief so that we can all revise. Okay, we'll do theories like this. Okay, so that can be a revision for us. Along with that, we can discuss ताकि कोई भूले नहीं. ठीक है, पर हमेशा के लिए याद रहेंगी theories. ठीक है. So that's the homework. Please write it down. Everyone has to prepare and we can all discuss. ठीक है, present भी करने को नहीं बोल रही मैं. ठीक है, discussion कर लेंगे and that's how we can learn. So this is your homework and thank you so much everyone for a wonderful session and for being so interactive, especially considering it was the first class. It was all new for all of us. Yeah. And for considering everyone and giving them a safe space to talk to. ठीक है?
Yeah.
And I think we should continue that. So that's how we'll be able to learn from our experiences. So from the next time, I want everyone to give their children's example. I don't want you to name any one of them. But maybe if you've dealt with a few clients, giving us a few examples about how did you feel in that particular situation, and what did you do, so that we all can also learn from that. ठीक है, we learn from each other's experiences. ठीक है, चलो,
Okay, bye.
bye bye, take care. It was nice talking to all of you. Thank you so much. See you tomorrow.
Thank you,
By
ma'am.
8:30 p.m.
See you tomorrow. Yes, see you tomorrow. Do the homework. Bye bye.
Bye. Good night.
Good night.
Thank you, ma'am. Good night.
Good night.